Hello and a very good evening to all our viewers who are joining me live in this News 9's Facebook and as well as YouTube page. And today I will be speaking about one particular problem, or rather a new trend that has emerged in the COVID-19 hospitals. Of late, the COVID-19 hospitals have been closely observing one particular trend, and that is entire families of residents getting infected by COVID-19 and getting hospitalized. So this particular study hinted at family members getting tested positive of COVID-19 because of the kind of hygiene, or rather the protocols that they ignore to follow at homes. And many of these individuals, especially the youngsters who go around the city and end up back at their homes, probably risk their family members' lives by touching surfaces and also using the same utensils and also the same restrooms which is being used by these youngsters who are wandering around the city, traveling through containment zones, and in the end they come back home, whereas come back home only to risk the lives of the elderly ones at homes. Now, in order to understand more about this particular study, we have with us Dr. Huliraj. Many thanks for joining me in this live interaction, Dr. Huliraj. So, doctor, what do you have to tell about this particular trend which is now emerging in many COVID-19 hospitals, where instead of an individual, an entire family is getting infected by COVID-19?
Yeah, I think this is what we were all worried about. See, everybody, even across the globe, this is the trend what we had. So because it comes, everybody knows, people very closely observing. It comes with a close contact and also aerosol. So both are the one which is very important, and along with that social distancing. See, if you are not understood what is the basic problem of COVID, how it spreads, this is going to happen. So recently in Bangalore, there is 22 members in the family got infected, admitted to hospital, treated, and majority of them gone through, and they were pulled through. Everybody pulled through the COVID situation. But the question is how it is going to be avoided and stopped. See, until people understand, everybody understand how it spreads and how best way to prevent. You cannot do much. Government and even public awareness cannot. So basically, every responsibility of every individual, it is they have to understand the social distancing is absolutely important, and wearing a mask is very important, and cough etiquette is very, very important. Contacts are very important, touching and moving through the containment zone and moving with the multiple people without protecting themselves. I think they will be digging their own grave. So this everybody in India, not only in India, every place across the globe, including Bangaloreans, people suddenly there is a lot of spike has happened. People has to understand. Until otherwise, they understand what situation and precautionary measures they take. I don't think anybody can help. Even government, nor individual, or any hospital or any institution cannot do much. So they have to understand the importance of social distancing, especially at home, because nobody wears a mask at home. So at least you should know that an individual, elderly persons are there in the family, kids are there in the family, people with the comorbidities there in the family. They have to be protected very nicely. If they are not protected, easily it will walk through them and causes the mortality, not the morbidity. Morbidity, apart from morbidity, death is definitely going to happen. That's what is happening. What we see in death, in spike in the death, especially in Bengaluru and recently in Karnataka. One other reason is monsoon, and the other one is people doesn't reach the medical facilities early. Those are comorbidities, so it spreads faster and causes severe disease and progress to SARS and death. So we have seen very frequently observed this phenomena. So everybody who goes out of the house, come back to the house, they should know this. What typically every past more than 10 months, people are telling hand washing, social distancing, mask wearing. That has to be followed very strictly, And as soon as they come back home, they should clean themselves, especially when they go through the containment area, multiple peer group meetings, parties, and they have to observe every day. They have to be very careful, wash themselves, and before they join the group. And if they have any iota or doubt, one of their colleagues or friends had a cough or a fever, or their family members who visit them, they have symptoms of viral fever, I think now everybody should consider themselves as a primary contact or secondary contact, and they should do the voluntary testing. So that is absolutely important. And see, anybody who gets the running nose, little cough, little fever, little body ache, their virus.
Now, doctor, speaking about the symptoms that you just now mentioned, when a particular person catches a cold or, has mild symptoms of COVID-19, often, the elderly ones in the family tend to give them homemade remedies which could, prolong the effect and also risk the others also. So what is your advice to these type of individuals who resort to homemade remedies?
Indian kashayas and all, they are working miracle, but that doesn't cure you.
That's true.
See, along with the kashayas and whatever hot things and all, along with that, they should reach the medical system. They should go to doctors, any other specialties, and show them, get involved. See, just simple going to a medical professional, it changes the direction, severity of the COVID. See, those who have mild disease, they can have a follow-up, they can have investigations done, so that early diagnosis, early identification of severity, stage of the disease can be done, so that plan can be there and confidence level will be more for the doctor as well as the patient and individual who are suffering. They'll be confident, so they know that they are going to doctors. They are showing the test has been done psychologically. They are protected, because half of the problem in psychological thing. People are scared. Nobody knows what exactly how the things affect, because we have seen people are dying, suffering, admitting, So those things, people are very skeptical. So that's why patients, any individual who has acquired any viral fever, they don't want to go to hospital because they have seen various problems. So that should not happen. They should go with confidently to meet the medical facility and get the evaluation done early, and treatment is there. See, there are so many controversies are there as far as the treatment is concerned. Right. Still, whatever we are giving, the treatment is adequate. People, what they respond, they are doing well. We know that what are the complications, so that we can plan their hospitalization or home quarantine or home isolation, and plan so that they can avoid spreading to the family members. See,
now, doctor, speaking about spreading COVID-19 at homes, many researchers have hinted that COVID-19 mainly is transmitted by the family members coming in contact with the frequently touched surfaces at home, and some of them even say it is because of aerosol. So what do you think is the major cause of the outbreak within the house?
See, one of the close contact, socially they are living. See, one of the things is sneezing, coughing, touching the various surface of the family, especially bathrooms and latrines and hand washing basins, utensils. So those things are the one using the same towels and bed sheets. So those are the one, there is likely chance if they sneeze and cough and they will live for some time. They may not be there for 2-3 days. They may be there for hours. If they are on the steel surface, they may be there for 48 hours also. So those are the things, they should be very careful. Steel surface area has to be washed, at least mopped with antiseptic or detergents, so that it won't cause a damage to the people. And most important thing is cough etiquette. Whenever they have a sneezing, running nose, cough and all, if they have a handkerchief or a mask, that's fine. If not, at least elbow of themselves, they can block it, so that at least 90% of the stream of whenever they sneeze and they cough, that can be blocked, because every cough and sneeze can move the aerosol to the extent of 21 feet. So imagine in a room of 20 to 30, if somebody coughs or sneezes, the whole room will be flooded with the virus. So people have to be very, very careful with those who have symptoms. They should isolate themselves or they should take a medication. or at least tell the elderly they should wear the mask. Because if a good mask is worn, to almost to the extent of 98%, 95 to 98% can be blocked with a good mask. If an individual single person using the mask, only 50% can be used. So those are the things which research has been done and analyzed and told. So people has to increase if anybody having a symptoms of flu, which is likely possibility if COVID, they have to wear the mask and isolate themselves. So then they can avoid the infection. So you see, recently I have a patient with the family recently gone outside Chikmagalur for a program. They came back. All of the family got viral fever. When we got it tested, this one boy of their family got positive. So I told them, all of them, to isolate themselves, not to venture out, not to go to office, not to talk to each other. Let them stay inside the room. Let them, somebody in the family who can cook and distribute, not to sit and talk and discuss and watch the TV. Let them see if they want to see TV, let them see to the mobile. So that they can avoid the cross infection. So that classical isolation is being done, social distancing is done. Past 1 week, they are showing me, not other person in the family, they have a family elderly, aged about 80, 70 years, both of them protected very well. So that has to be done. The need of the hour is, we have to protect our elderly and the people with the comorbidity or anybody in the family with a good social distancing, isolation and mask. That is very, very absolutely important, is the need of the hour. They should not go on sneezing, coughing and do the things what they want.
Right, Dr. Huliraj, many thanks for joining me with all those details. Well, that was Dr. Huliraj giving us his insights, and also he gave us a case study of a particular family which traveled across Karnataka and then came back home, only to find out that one boy in their family was infected by COVID-19. And often many reports have suggested that the super spreaders are often not out in the public but are the ones at home, because they are the silent carriers of COVID-19. They are asymptomatic, and the pre-symptomatic COVID-19 patients do not take care, and those with symptoms often have a misbelief in themselves, claiming that it could be a minor flu given the kind of season that we are currently in. But like the doctor clearly mentioned, if you have even the slightest of symptoms, please do not ignore them. Those could be the signs of a COVID-19 virus, or rather it could be a sign that you might be the super spreader at your place, and you wouldn't want to be that. So in order to avoid that particular situation, make sure you approach your closest healthcare professionals and get yourself treated. And if it is a COVID-19 positive, immediately isolate yourself, and also make sure that everybody at home is also isolated with social distancing. So if you guys have liked this piece of information that we have shared with you all, please drop in your comments, and also like, share and subscribe to News 9 on various social media platforms. Thank you for watching.